Hello, welcome to From the South. I'm Laura Prada from our Telesur studios in Caracas, Venezuela. We begin checking our headlines. Countries of the Caribbean community reported joint toll of 959 positive cases of COVID-19. China imposes new lockdown measures in Harbin City to prevent the spread of the novel coronavirus. Iran responds to U.S. threats about sinking Iranian vessels in the Persian Gulf. We begin our news taking a look to COVID-19 numbers in the Caribbean region. All this data have been submitted by the health ministries of the region. Let's check it out. In your screens here you have the data numbers. Here we can see that Jamaica has the highest COVID-19 rate, 252 cases, 5 deaths and 27 recovered. Also, we have Trinidad and Tobago as the second country in the region, in the Caribbean region, with the highest infection toll, 115, 37 recovered and 8 deaths. Following in the third place, we have Bermuda with 99 confirmed infections, 39 recovered and 5 deaths. Overall tolls, we have 959 confirmed cases, 53 deaths and 228 recoveries. As we were saying, all this data have been provided to CARICOM, to the Caribbean community, by member states' ministries of health. This is the COVID-19 toll, COVID-19 numbers in the Caribbean region. In Antigua and Barbuda, they have reduced the curfew hours initially from 7 a.m. to midnight to between 6 p.m. and 6 a.m. until May 15th. During the 23 days, construction projects are permitted to recommence and restaurants may open for delivery. Drive-through and curbside deliveries only. All social distancing rules and the wearing of masks still holds. Meanwhile, no more than 2 people are authorized to travel together. Antigua has 24 coronavirus cases, 3 deaths and 10 recoveries.
New regulations would allow for businesses to be conducted between 6 a.m. and 6 p.m. As of 6 p.m., we expect the streets to be cleared and we expect all other activities to cease, and then people would be expected to retreat to their homes.
Jamaica has recorded 19 new COVID-19 cases in 24 hours, taking the country's toll to 252. 131 of the positive cases are attributed to a call center in Portmore.
So the number of confirmed coronavirus disease 2019 COVID-19 cases has risen to 252. And that's based on 19 new cases that have been received in the last 24 hours. 9 of these, which we just received, we will provide additional information on in terms of male-female split, but 10 we received earlier today. That 10, 2 are males and 8 are females, with ages ranging from 20 years to 50 years. 7 are associated with the workplace cluster. 2 cases are contacts of confirmed cases, and 1 case, this is of the 10, is under investigation. There are now 131 confirmed COVID-19 cases related to that particular workplace cluster. Ages range from 18 to 52 years, including 104 females and 27 males. They are primarily from the parishes of St. Catherine and Kingston and St. Andrew.
And Brazil, the worst hit country in the Latin American region, has started to gradually reopen businesses on Wednesday amid the COVID-19 epidemic. The viral illness is spread rapidly across the country, prompting the government to implement social distancing measures in late March. Despite a steady increase in cases, President Jair Bolsonaro has insisted in the measures being relaxed. As of Wednesday, Brazil reported 46,348 confirmed positives and 2,934 COVID-19 deaths. In Peru, the government will pardon around 3,000 inmates amid the COVID-19 pandemic. The Minister of Justice said the government will issue a decree this Thursday to make it official. Among the inmates to be released are pregnant women, mothers with children under the age of 3, prisoners serving less than 4-year sentences, and people over 70 who did not commit serious crimes. According to official data, at least 13 prisoners have died and more than 40 have tested positive for the novel coronavirus. The country has more than 19,250 cases in total and a death toll of 530. Moving on, Russia has reiterated its support to the Venezuelan government and rejected U.S. interference in the nation. The Foreign Affairs spokesperson took to Twitter and said, "Only Venezuelans, not the U.S., can and must decide their future in a direct dialogue between themselves without any outside interference, preconditions, or ultimatums. Never in global history has a demand led to the emergence of trust." On your screens, you have the tweet made by the Foreign Affairs Ministry of Russia. This was said by the Foreign Affairs spokesperson, Maria Zaharova. And a medical brigade from Cuba arrived to Cape Verde to help contain the spread of the novel coronavirus in the African island. The delegation is made up of 5 doctors, 10 nursing professionals, and 5 specialists in hygiene and epidemiology. They will join other 39 Cuban specialists already in the African island that has reported 68 COVID-19 cases. This brigade represents yet another show of solidarity with the people of the world by Cuba, and this is the 22nd health brigade that Cuba sends into the world in the midst of the COVID-19 pandemic. Time for a first break. Remember, you can follow us on Twitter at Telesur English and on my account at Laura P. Telesur. We'll be right back with more news from around the world. Back with our news, Harbin, the biggest city in Heilongjiang province in China, has imposed new lockdown measures to prevent the spread of the novel coronavirus following a surge in cases. The 10 million people city has banned all foreigners from entering residential zones. A new cluster of at least 70 cases have been linked to a 22-year-old student who has spread the COVID-19 after returning from New York, United States, according to officials. The city was already battling a wave of new cases who had arrived from neighboring Russia. Harbin City had already ordered isolation for those arriving from outside China or key epidemic areas, while checkpoints have been installed at the airport and train stations to screen those coming from elsewhere. Meanwhile, China announced this Thursday that it will contribute with an additional $30 million to the World Health Organization. Beijing, which had already donated $20 million to the organization, stressed the money will serve for the prevention and control of the COVID-19 pandemic and to support improvement of health system in developing countries. Last week, as we remember, United States cuts its monetary contribution to the WHO.
Supporting the WHO at this critical time in the global fight against the epidemic is defending the ideals and principles of multilateralism and upholding the status and authority of the United Nations. The virus is the common enemy of mankind, and the international community can only win the war if it works together. China's contribution to the WHO reflects the support and trust of the Chinese government and peoples for the WHO, as well as its contribution to the cause of world public health and the global fight against the epidemic.
In the United States, an additional 4.4 million citizens filed for unemployment last week, adding to a total of over 26 million since the coronavirus pandemic shutdown hit the U.S. economy. States across the country are facing problems with the number of people applying for unemployment benefits, while economists expect the figure to steadily decline going forward. This Thursday, the United States reports more than 852,000 confirmed cases and the number of deaths to more than 84,000. And in Russia, medical facilities are being adjusted to help authorities cope with the COVID-19. A trauma center in Kazan City in the Tatarstan Republic has been converted into a temporary hospital for COVID-19 patients, currently housing around 50, but with a total capacity of 200 people. Medical staff have received additional training to be able to treat patients in intensive care units. They sleep in hospitals' dormitories rather than return home at the end of their shift in order to protect their families from infections. The overall number of cases in that country has currently surpassed the 62,000 with a death toll of 513. Meanwhile, the German Chancellor Angela Merkel warned of a setback in the fight against the coronavirus if restrictions are eased too early. Speaking to a parliament ahead of the European summit, Merkel told lawmakers on Thursday that Germany is committed to helping other European countries in their fight against the novel coronavirus.
Lassen Sie uns jetzt das Erreichte nicht verspielen und einen Rückschlag riskieren.
Let us not squander what we have achieved and risk a setback. It will be a shame if premature hope ultimately punishes us all. Let us all stay on the path in the next phase of the pandemic, smart and careful. It's a long journey. We can't run out of stamina and air too soon. One thing is clear, we should be prepared in the spirit of solidarity to make significantly higher contributions to the European budget for a period of time, because we want all member states in the European Union to be able to recover economically.
Spain has suffered the third highest number of deaths in the world from the pandemic, after United States and Italy with infections, now more than 213,000 cases, Health Ministry figures showed. As of Thursday, the country's overall death toll has surpassed 22,100.
Unfortunately, we still have 440 new deaths, and although these are still many more than we would like, we all know what this means. It is true that throughout the week we are remaining in the low 400s, from 400 to 440 as of today, whereas last week we were in the range of the 500s. We are seeing ICUs growing by 0.8%, about the same as we were seeing the previous days, and the number of hospitalizations is growing by 1.2%.
The British government's chief medical advisor has warned that social distancing measures in the UK may have to stay in place for the rest of the year. As of Thursday, the country has reported almost 134,000 COVID-19 cases and more than 18,100 fatalities.
In the long run, the exit from this is going to be one of two things, ideally, one of which is a highly effective vaccine, and there are a variety of ways vaccines can be deployed. They can be deployed for damping down epidemics, they can be deployed to protect vulnerable people, or highly effective drugs so that people stop dying of this disease even if they catch it, or which can prevent this disease in vulnerable people. Until we have those, and the probability of having those any time in the next calendar year are incredibly small, and I think we should be realistic about that, we're going to have to rely on other social measures which of course are very socially disruptive, as everyone is finding at the moment.
Meanwhile, scientists from Oxford University, United Kingdom, began trialing on Thursday a COVID-19 vaccine on humans for the first time in United Kingdom. Researchers at University Hospital Southampton and University of Southampton also joined the research. The study involved up to 510 healthy volunteers between 18 and 55 years old, with around 187 participants recruited in Southampton. According to the World Health Organization, more than 70 COVID-19 vaccines are under development worldwide. Time for another break. You stay tuned with us. We'll be right back. Back with our news, the leader of the Iranian Revolutionary Guard warned on Thursday that its forces would target the U.S. Navy after President Donald Trump's tweet a day earlier threatening to sink Iranian vessels. The high-ranked official stressed that they have also instructed their military units to target any U.S. Navy ship or combat unit at sea in case of any threat to their vessels. Salami highlighted that the Islamic Republic considers security in the Persian Gulf as an essential part of its strategy to defend its national interests in the Gulf. Tensions between the two nations have increased since the U.S. decided to withdraw in May 2018 and unilaterally from the international nuclear agreement with Iran and reinstate sanctions against the Islamic Republic. United Nations Security Council will address on Thursday the situation of Palestine aggravated amid the COVID-19 pandemic and the Israeli persistent intentions of territorial annexations. Meanwhile, the Palestinian Authority spokesman Nabil Abu Radeneh rejected a statement of the U.S. Secretary of State Mike Pompeo, who recently expressed that the decision to annex a large part of the occupied West Bank is the prerogative of a new Israeli coalition government. On his part, the Deputy Secretary General of the Arab League, Hossam Saki, warned that Israel could advance and its claims to annex the occupied Palestinian lands to its territory in the midst of the COVID-19 pandemic. The pandemic has hit the Gaza Strip and the West Bank with figures that has exceeded the 400 cases, with a death toll of only 4 fatalities. Muslims in Malaysia will welcome Ramadan amid strict movement restrictions in order to prevent the spread of the new coronavirus. The restrictions, called the Movement Control Order, were initiated by the government in a bid to reduce COVID-19 infections in the country. Mosques around the capital city, Kuala Lumpur, remain closed and Muslims were told to pray at home. These restrictions are felt by small businesses who rely on the Ramadan season to sell traditional food. Restrictions include movement controls, banning public gatherings, and urging social distancing. Malaysia has reported till the moment 5,603 cases of COVID-19 with 95 fatalities.
Usually we are expecting an increase in sales, but maybe because of the economic impact, we are expecting a 50% decrease compared to previous Ramadans. So yes, it's 50% decrease.
Members of the South African National Defence Force intensify operations in amidst a nationwide lockdown on Tuesday. The South African government announced that they will increase soldiers' presence on the streets and around the country in order to provide aid as the virus continues to spread.
This is very effective because we can see that our people are starting to hear the call from the president, and most of the people are wearing masks, most of them are sanitizing, and so most of the people are staying at home. It is there and there where you find that people are just loitering around and not knowing where they are. But we've got a way of addressing them and talking to them. And advising them to stay at home.
So police are helping because they keep people away from the streets so that people can sit inside the houses, because this thing kills. It spreads every day. So if people stay inside their homes, then the virus will go down.
With well over a third of the world's population under lockdown, education systems across the world have had to adapt to extreme circumstances. In Ivory Coast, for example, the government has implemented a project called My School at Home, by which students can receive classes from home. The project preliminarily uses the WhatsApp mobile application and Facebook to provide students with continued education. Authorities said that for the first time being, the program is only available for people in the 5th, 9th and 12th grade, but will soon be expanded.
True that we are in Abidjan, but access to TV is not easy for everyone. Personally, we don't have a TV at home, but with the online courses, I can follow the lessons better, and even when you don't understand, you can ask questions to the teacher. You even talk like friends. It's very interesting. He answers you when you don't understand. He makes a voice message, or he even makes a video to send you, and then it is even more understandable. These are free courses organized by a group of private teachers in the community of Port Bouet and supported by the town councillor Mr. Bande Karamoko. These courses take place in the WhatsApp platforms in groups of 50 students.
With this information, we come to the end of this news brief. Of course, you can find this and more information on our website, TelesurEnglish.net. And of course, the invitation for you is made to continue with us with Telesur, always together, connecting our global thoughts. Until next time, thank you for watching.